So the topic for today is pickleball and pickleball injuries. Pickleball is one of the most popular and fastest growing sports in the United States at this time. It's a combination of ping pong and tennis, and it has really attracted a lot of new athletes to the game. In my practice, I do see a lot of athletes that get injured playing pickleball. I would tell you that the average age is almost 70, so it has attracted a lot of athletes over age 50. Again, we do see a lot of injuries with pickleball. Usually it's minor sprains and strains, little muscle aches, but there's a lot of patients in my practice that I see that come in with shoulder injuries. So a lot of patients who are over age 60 can have a rotator cuff tear that was not symptomatic, and then all of a sudden they take a wild swing or reach awkwardly, and all of a sudden now they're having shoulder pain and their rotator cuff pain kind of basically presents itself. Another thing that we usually see is patients who have had arthritis in their knee, and they would have been doing okay, but again, a minor twist that causes them some pain. And there's times when patients just simply tear a meniscus from a simple twisting type injury. You know, there's a lot of things that we can do to help decrease the risk of injury in pickleball. What I would recommend is, first of all, talk to your family doctor, make sure you're healthy enough to be able to play a new sport. Some patients have a trainer or they have a physical therapist that they go see for a few visits to make sure that they're ready. I always recommend, for if you have a chance to have private lessons, to go ahead and get that as well, because that could be very, very helpful. But before you step onto a pickleball court, one of the first things you should do is to really warm up the shoulders, warm up back, hip, and knees. You know, for the shoulders, it's a simple warm-up exercise. It does take, a couple of minutes to do by holding arms out to the side and doing clockwise and then counterclockwise circles, but taking about a minute for each way of doing the exercise, and that will slowly warm up your rotator cuff. Obviously stretching to help, stretch your hamstrings, stretch your back. For getting more warmed up before you play, shuffling side to side. If your knees are not too bad, being able to jog a little bit before you play. Otherwise, jogging in place can greatly improve on your ability to help decrease the risk of having some of these injuries. We really hope that you get to enjoy playing the sport. But again, as usual here at Tulsa Bone and Joint, we always strive to keep moving your life forward.